You ready? Yeah, perfect. Sunglasses, please. Just gonna put the chair back now. Perfect. If you can scooch up for me in the chair. Amazing. Thank you. Thank you. Open up for me. Relax. Thank you. I'm going to remove them. Do you need anything? Okay, Rashid, this is right hand side. Right hand side, left hand side. Thank you. And if you can, oh, H is here, never mind. Yeah. Good? Close a bit. Thank you. Stay like that. Okay, we don't have water. That needs fixing because I can't do anything, Rishi. We don't have water. Turn what off? The chair? Oh, okay, all right. Yeah. Has it happened before? No. Beautiful. All right. The triplex. Just put it separate. Let's see what happens. Thank you.
Yeah, here.
No, all of them are the same.
Really?
Yeah. Yeah, it's fine. Sensitive. Don't worry, it'll be ending soon. I think your numbing is going away, but you really don't need it anymore. Unless if it's uncomfortable. Can I have a brush, please? Whenever you have time. Thank you. Should be fine. Yes, because it has plastic, should be fine. Yes. Do you want me to? Yeah. You're gonna come back? Oh. Okay. Okay, so there have a few questions I'm going to answer while people get the veneers ready. Why no rubber dam? Because I don't cement with rubber dam. It's extremely difficult. And to be frank, in my opinion, unnecessary. CAD-CAM veneers, no. I send my veneers to our very beautiful lab because there's a lot of art going on with making the veneers, painting them, glazing them, layering them, translucencies and all. So it takes a lot of time and honestly skills. You would need a ceramist who only does this job. So I would rather get them done at the lab. But when it comes to posterior crowns, where cosmetic is not as important, I would go ahead and if things are, you know, as easy as possible, we will make them in-house with CAD-CAM. If there's anyone having a question, let me know. From Australia, no. Yes, I am actually. I am from Australia. I live here for the past 10 years, but originally I'm Iranian. I'm gonna turn the camera around and go back to the treatment room. I had a moment, so I thought we could chat. This room is absolute mess because the chair doesn't work and everyone's fixing the chair. So here we go. Forgot my glasses. Thank you, Rishi. Can I please have bond?
Just wait a minute. This one, I'm not sure that probably one of them is mixed.
That should be left
That
because
left
there's a
is
crown.
unchecked,
Yeah,
yeah.
yeah. Thank you. Sure, sure. Thank you. This side?
Like this side.
And how do I see?
Just a little bit. Oh, yes,
Thank you. So I need a couple of them. Thank you. More, please. More, please. Just one. Thank you.
A1.
Yes, please, yeah. It's, which bonding is it? Scotch bond. Thank you. Thank you. Sure, sure. If not translucent, it's fine too. Okay. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Huh?
Let's just.
Thank you. Thank you. Perfect. Okay. No, that's horrible. Can you get the Oral-B, please? It's okay, she'll come. Thank you. Thank you. That floss, if it's the only one, please just throw it out. And I think it's the only one, to be fair. I don't think they're buying it. It's very tough on the gum. I told Yalda to, it's just,
Like a rope.
yeah, it's awful. Hmm? In a second, we have to floss. Mm-mm. Hang on. Tissue, please, a new tissue. Okay, let's floss, but only when you go in, pull it out. So don't.
Yeah, sure.
Hang on. Thank you. And wait. No, the other one. The back.
This one? Really? Oh. It.
Wait. Thank you. Thank you. Let's wait now. One more cotton roll. Thank you. Okay, bit of suction at the back, please. I'm gonna light it just for 2 seconds. Thank you. No, just gonna floss again in a second. All right. Go. Wait. Best. Thank you. All right, let's light. Okay. I'm just gonna leave it for 5 minutes, but can you tiny bit suction every now and then? Thank you. All right. Hello, people. So they're having a few questions. I'm going to try to answer. Resolution or I can mention. All right. Regarding rubber dam, many people asked, and it's a personal choice, guys. And you're right. It's important that you don't have any cement underneath the gum because we don't see it. It gets dislodged under there, and patient comes back. If they come back, they might be traveling or whatever. With gum inflammation, so you're opening the patient's future up to have gum inflammation, gingivitis, even periodontitis eventually. And I have seen those kind of work, especially with composite veneers. So usually what I do, her gum was healthy and the temporary pushed her gum a lot up. Usually what I do, I place a retraction cord, and after I tack light, I remove the whole retraction cord. That way, the retraction cord will remove all the excess cement under the gum. That's the best thing to do. Today I didn't do it because her gums were a bit pushed up already by the temporaries, so I had a lot of room. So as soon as I tack light, I go in and remove all the excess cement. Right now, just to be sure, after I give it a few minutes just to make sure it's settled, I'm gonna go back in and do a kind of a very good dental scaling under the gum, not on the veneers, under the veneers, like on, you know, subgingival, because these veneers are equigingival. So I'm gonna go under the gum and clean out if there's any cement, and then I follow up. So this, by the way, I bought for you to be able to work and show you what's happening, but only patients who give me consent, and also things that, you know, are not gonna splash and stuff. So that's that. How do I take it off? If you have any questions, ask me. I'm gonna be here for another few minutes. Yeah, sure. That's regarding rubber dam. No, I don't know, John. Somebody asked what kind of bond we use. I think we've been using this bond for such a long time, and I'm happy we did. It's G Premio bond from GC. I'm happy with it. For fillings, I use it. For cementation of the veneers, you can use ceramic primer. You can use bond, ceramic primer, sorry. You can use tooth primer, or you can use bond, whatever, you know, is around. Honestly, they almost do the same work. I'm going to see if I can see your chat. All right, your guys are asking me names of, I'm assuming, other doctors, but I don't know them, so I can't give you anything about their work. I'm sure they're very good doctors. So yeah, that's that. If you have any questions, I'm going to be here for the next few minutes. After that, I'm going to go back and finish the job. How do we finish it? I'm going to clean under the gum, make sure there's nothing stuck under the gum, no cement. I check the bite using a U-shaped articulating paper. That. Make sure all her bite is correct. So if the veneers are touching, they're touching light and all in the same areas. Can you, the best veneer doctor from Australia? No, I'm sure there is better than me. I'm just trying my best, but thank you. If you're asking if I can recommend anybody good, in every city you can find very good doctors. You just have to do your due diligence, have a look online at their work and what are their patients saying about them, and have an open eye about the fact that most people would give a comment or a feedback when they're angry. So have an open eye about it. But if I was doing anything to my face, like cosmetically, I would look at the doctor's previous work and then decide. Is it often people show up with sunglasses? No, she doesn't show up with sunglasses. In Australia, at least, we give people sunglasses when we put them in the chair because of the light. So, yes, some people actually get surprised, especially if they have recently moved to Australia. When we give them sunglasses, they're like, why? And that's because of the light. I am a general dentist, yes. I have a specific interest when it comes to cosmetic dentistry, but I do general dentistry mainly. I do a lot of orthodontic treatment, Invisalign braces, implants, veneers, crowns, you name it. When you run a dental clinic, I think you need to at least know all the treatments. You don't have to do them. For example, I don't do root canals anymore. I haven't done root canals like in 5 years, just don't like them. But at least as long as you know how it's done. Endo extractions. Yes, we do endo and extractions. All right, I'm gonna go back into the room. Shall I take you guys with me or shall I end the live? I do surgery too, yes sir. This thing is heavy, so I'm going to try my best to keep you with me, but I might have to end the live in there. Let's turn this around before you start looking at my double chin. You alright? Yeah? Can I please have gloves? Thank you. Everything's on me today. Sorry, Amir, I'm gonna need the light, okay? Okay. Why is it loose? Oh, oh, that's good. Sorry, almost done. Thank you. Now, can I please have a floss? It's all done. I did a very good clean under the gum because I want to make sure there's no glue or cement left there. There is no temporary material from last, few days left there. And so it's all clean, but we'll check again. I'm going to floss, make sure you can floss easily at home. So it's a bit bleeding, but that's because of that. Honestly, you did a great job. Your gum was very healthy compared to the fact that you couldn't have been flossing for a while, probably. Veneers or crowns, they're not easy to come out, so don't worry, don't stress. But if it happens, just give us a call. I mean, things sometimes go wrong, and we'll see you right away and fix it and see why. No, no, no. I use them only when there is, you know, the gum actively is bleeding. This is bleeding because I cleaned a bit roughly. Okay, let's. It's the gum. Amazing, margin is good. Can I please have, perfect, I'll take this off. Just relax for a while. We're gonna give you water to rinse. And then I check your bite and you're done. Take your time, I give you a few minutes. Are you all right? Yeah. Good, it's all done. There you go. All right, people, that was fun. I try to do this more. If you like this, don't forget to comment when it's uploaded. Bye-bye.